Know me, I am Dr. Caroline Kasich, and tonight we're going to talk about dry needling and cupping. So both are just different forms of therapy that we use. Basically, something that you're fine. Welcome. I promise I won't keep you all here all night either. My biggest fear is public speaking. This is public speaking to me, so bear with me, interact. If y'all have any questions throughout, please let me know. So dry needling and cupping. So dry needling is basically working with myofascial trigger points. It is going directly to the area of pain of the problem. It works with, a lot of people always ask, is this like acupuncture? What's the difference with acupuncture? Honestly, the only similarity is it's the same needle. And I can pass around and show you all them. They're very small, so you can barely see, but I'll pass like this around. The only thing they do vary in is they're 1/2 inch to 4 inches, and it just depends on the area of where they're going. So with dry needling, it works directly to the area of pain, whereas acupuncture is different type of medicine as it's working with different energy points, different meridians. This is going directly to the area of pain where you're having that problem. So with a lot of times you could be having problems in some area that say an adjustment can't get to, or you can't even pinpoint where you're having that pain. So this is going directly into that muscle. The biggest thing, and it's probably the scariest thing for people to hear, is you want to go as deep into that muscle as possible. So what it's doing is it basically is creating blood flow to that area. So it's drawing blood flow, it's creating circulation, because what happens when we have those, did you get to see? Oh, she's good, she knows. And so a lot of times those muscles, those trigger points are caused from reducing oxygen in that level, in that area. So this is just putting that needle, basically creating a bunch of micro traumas to help speed up and promote the healing process. So this does not have very many contraindications at all. Obviously, phobia of needles is the first one. Or if you have any, I definitely don't recommend that. I actually did have a patient once that did not inform me that they had a fear of needles, and they were a little weary. So definitely don't, just still saw very good results, but he was like, oh, I pass out every time I give blood. He's like, but I give blood every time. Okay, I would probably advise not to do that, but still wanted to try the dry needling, still saw very good results, but yes, wouldn't do that again. So that was the only near pass out story that I've ever had. And then any blood disorders, anything like that is a contraindication to it. But this is very great for extremities. So think of shoulders, knees, ankles, elbows, hands, wrist, feet, things that you chronically have an issue with. Say, I've had this shoulder problem for 20 years, but I don't want to have surgery. Or they won't do surgery. Well, I can't tell you the amount of people that have told me they just want to do surgery, and I don't want to have surgery on my shoulder, on my knee. I will tell you, sometimes you won't see results after one time. And some people see instant gratification, like Tiffany. Some people, it takes 3-4 times. I'll never do it more than, say, 6, sometimes 4, but it just depends. But if you're not seeing those results, then we want to look elsewhere. But we do an examination, make sure that you are a good candidate, that this is something that would work for you before, because I don't want to waste your time either, and I want you to see good results. Especially, it helps speed up the process. You're going to see good results with adjustments. Sometimes it just needs a little push. Sometimes it's a nagging knee or shoulder or ankle, whatever it may be, that it just right there, but you want to see the results with it too. And then things like TMJ. I had a patient that, again, they wanted to do, TMJ is the bones that attach here, and they wanted to do surgery on her. She's 20 years old, and they never gave her any other option. She mentioned it to me as her chiropractor, and we started adjusting that. She saw some results, but there was still a lot of scar tissue. So the needles break up scar tissue. It's breaking up adhesions, really trying to get into that muscle to help, like I said, speed up that healing. And she did it probably 3 times, saw amazing results. Then she just maintained it. She came in about once a month just so that it wouldn't go back to where it was before. Another patient, same type of thing, but knee problems. She came into the office as, I don't work out, I can't run, I'm just going to be a walker. But she wanted to get back into working out. I told her a specific place where a certain gym that's nice to be able to power walk, and then you can kind of build up, and if you want to run, you can. And now she's a runner. She gets dry needled more as a maintenance. She does horseback riding. She's had more falls than I know what to do with. And even somebody like that who has had a lot of trauma in their life, who's really, then that's a lot of people, they're on the end of the rope. They've never really been able to have that type of relief, and that did that for her. Does anybody questions?
So is it curative?
Excuse me?
Is it curative or more palliative?
I would say it depends. It depends on how severe it is, because some people, they will see immediate results and it will stay that way. Some people, it's just maintaining it. It will get them out of pain for a few weeks, maybe a few months, and you do it again. So it varies though, but I've seen some people that they do it a couple times and it's gone. But then there are others that the problem has just been there for so long, and there's so much scar tissue, or there might not be that much cartilage, and there's nothing you can do for them. But so cupping is the other therapy that we wanted to talk about today as well. Very similar, but it's more on the wellness side, I would say, as well, but it's also, I can pass around these. So cupping, you might have seen, became very popular after the Olympics with Michael Phelps. You saw those little circles with bruises on his back. He had cupping done. So basically it's drawing blood flow to that area, but it's pulling out toxins to get things out to help speed up the process. So biggest thing with cupping is you might experience some bruising, or a histamine reaction, so itching might occur, but it's doing the same thing, but working a lot more with muscle tension and cover a larger surface.
So it's just suction.
It's just a suction cup.
What's the thing on the end?
So this is, you pump it, and it's pumping that, yes, I can do it to somebody if you'd like. Gladys, would you like to be my guinea pig? We're gonna have a few guinea pigs because I think that it helps to see the process done. So do you mind?
Can you do my shoulder?
Sure.
You want me to face down?
Face down.
All right.
So can I do this shoulder?
No, why don't you do it?
Okay. Well,
The shoulder that hurts.
okay.
They won't be able to see that you're saying.
They can see, I think. So basically, it just goes directly onto that area. And oops, I'll just do this for a few seconds. So this just stays on for a few minutes. And so all it's doing is it's drawing blood flow to that area, pulling those toxins out, trying to get the healing process promote it that way.
And it feels a little strange.
It's tight. It's more of like a pinching type feeling with this. The biggest thing after dry needling and cupping is you want to draw as much blood flow to that area. So heat is why you want to do that. If you drink wine, ladies, drink wine. So it helps draw blood flow to that area to help speed up the healing as well. So typically they don't stay on for too long, about 10 minutes or so. And then, does anybody have any questions?
Is she bruised?
And it looks like.
And it will bruise a little bit. That is the main,
I actually had some done on Tuesday, right?
yes.
So you can see some of them. Can you see some of them?
That typically is the main result of it. Yes, but it does help a lot with muscle tension. A lot of massage therapists do it. They'll move it around, another type of
I wonder
thing.
if that would be helpful for menstrual cramps.
It can be, and well, getting adjusted helps as well too, but it can help just with the muscle tension with cramping. So there aren't really any areas that you cannot do with the dry needling as well. You can do, I've done people's heads for headaches, migraines, neck, shoulders. You can do their sternum. A lot of knees, a lot of shoulders do very well just because of how much scar tissue can build up if you have had traumas in that area. It's great. Cupping and dry needling are great for, yes,
With the cupping, you said it pulls toxins, right?
yes,
So
pulls
you-
toxins out.
Right, out. So do you go through like a, like when they pull toxins, you're gonna have, like, the next day you might have a headache or?
You can sometimes, you could, but not necessarily. People more so have headaches or experience fatigue with the dry needling, just because it's focusing so much energy onto that area, your body fatigues. I know when I
had
did,
both done, and the needling, I didn't feel that.
right,
But after you did this,
just
the next
experience
day I
that.
was like, oh gosh, what's going on?
Right.
So it's like, what was that?
Like, oh, I forgot.
I get a headache, and then,
Yep.
then I was tired, I was like, oh, what the hell?
And
it only lasted that day, and then
Yep.
it's gone. So
And now
I was
you're-
just wondering.
yeah, absolutely. And everybody's different. So some people get very sore after they get it done. I get very fatigued after I get it done. But I do it once and I'm good for a few weeks or months. And some people it takes a little bit. Some people don't feel anything. Same with an adjustment. Some people get sore after each adjustment. Some people don't get sore at all. So, but I did want to say with things like plantar fasciitis, really good with cupping and dry needling. People see very, very good results with that.
You have to have a flat surface that's the width of that cup, right?
It just, not necessarily, if they just lay face up, you can just do the bottom of their foot with the needles or the cupping. They just stay. It does really well though. That's,
I remember that.
yes. It's not I was very reluctant to even do that to somebody just because I just feel like it would hurt so bad, but they were like, oh, I don't even feel it. So, does anybody have any other questions, comments, concerns?
Again, what's the difference between acupuncture and dry needling?
Acupuncture is working towards it focuses on energy, meridians,
Yeah.
things like that.
Okay.
Dry needling is working more with trigger points, more musculoskeletal, and works more with the anatomy of going directly to the area of the problem.
Okay.
So it gets deeper into those tissues that,
The needles go deeper.
yes, as deep as possible.
Oh, is that right?
So that, like when we were learning how to do it, they had us take a grapefruit and stick needles throughout it, and then one of them hit the table, and he was like, that's what you want it to feel like, because you want it to hit bone. People don't feel it, making it seem scary, but it's not. I promise you want to just go as deep into that muscle as possible so that your body's working so it can get the full
Why is
benefit.
it called dry?
Because there's nothing on it. So it's just the actual needle going into that area, and then it's your body trying to basically heal. It's drawing blood flow to that area. It's just trying to create all these little traumas in that area to help speed it up. So it's very similar to like an adjustment. You're we're just putting the bone back to where it should be, so your innate can take over. Same thing with dry needling, just putting the needle into that area where it should be, so your body can basically get rid of that
And
problem area.
And you sit with it in the needle,
Yes, so that's another thing. So
like acupuncture does.
yes, so you'll never do more than 30 needles at a time. You can do more than one area at a time, but you'll typically lay there you can lay there for a few minutes depending on the area, up to about 15 minutes. Typically the longer you sit, the more it's working, so I typically have people wait longer, so full benefit.
You know, I've seen cupping done once with smoke or fire.
Yes,
What's it
we
like?
don't do that.
Is there a difference?
It's just another way to draw blood. It's just same thing, but so you can do it just with like a suction by doing it that way, or you can use with actual heat, but we don't do that. Just like how I don't like fire enough, so at all, and so they do that with dry needling as well. There's actually, you can put, some people have had twisting done, but typically you don't want to do that. If you can do it if it's like 1/2 inch needles, but if it gets the larger needles, you don't want to have that done. So if you ever hear of that, that's wrong. And if like connecting like an E-stem or TENS unit, a lot of PTs do that as well. It's just stimulating that muscle even more. So, but I did want to show you dry needling to somebody if she does not mind. So that way y'all can see it as well. And you always want to be laying down.
Would you recommend doing dry needling first, then cupping, or cupping, then needling?
You would do cupping, then dry needling if you're doing it the same day. Yes. You never want to do the opposite, because if you're doing dry needling and then you do cupping, then you're basically pulling blood flow out. So we don't want that. So we'll have, would you like to tell them your story?
I can. Hi everybody. I was introduced to dry needling last year by a physical therapist. I have extensive osteoarthritis, and it's basically in my knees. So I'm bone on bone, no cartilage. I've got bone scars, torn meniscus, things of that nature. So my range of motion was not that great. And so my physical therapist wanted to know if I would be willing to try the dry needling, and I did. As Dr. Caroline said earlier, it's not a cure-all, but what it did for me, it removed a lot of the chronic pain that I had. I am still stiff, so if you see me kind of waddling, it's because the stiffness is still there, but the pain that I endure on a daily basis and the inflammation, dry needling honestly takes a lot of that away and a lot of the pressure. Dr. Caroline basically focuses on my knees, but I've noticed that my ankles have gone down a whole lot as well. So I would say, and I attribute it to that because I noticed after we started doing the dry needling that some of the inflammation and pain in other places have subsided as well. I have lymphedema because I had cancer. So if you do have underlying conditions, just check with your doctors and things like that regarding those issues to make sure it's okay. But my doctors are good with it. And so I can sleep well at night instead of getting up trying to find the nearest medication, because I'm here with Dr. Caroline at least every 2 weeks. Okay.
You just come once every 2 weeks.
Yes. I would ask you not to be afraid. There's nothing to be afraid of. The needles are fine. If you can take a flu shot, if you can give blood, it's a walk in the park. Yes.
Much thinner needles than that.
It is a walk in the park.
Guarantee it.
If you're suffering, I say you have nothing to lose. That was my thing. And if the pain is bad enough, just try it, if you're interested. If it doesn't work, it's not your cup of tea, then you don't have to. But I trust Dr. Caroline with my life. That's why I'm here every other week. So, but
You're
that's
so
what I'm gonna
sweet.
do.
As I need to let you know.
Which one you want?
Let's do this one so that they can see. So we'll just do a few just so they can get an idea. So always want to make sure the area is sterile.
So you're just doing one knee at a time?
Typically we do both for her, but just so that y'all can see.
Yeah. You can do two
Yes,
extremities.
absolutely. So the areas, you can do more than one area at a time, but typically in the beginning, like if say somebody's having a shoulder and a low back, I would do one first. That way all of your body's energy is focusing on that area, and then when it gets further on, to do both. I didn't bring a trash can up here. All right. So, just so that y'all can get an idea. So very, very small.
How far are you putting it in?
You want to go as deep as possible. So sometimes you'll hit bone, sometimes you don't, but
2 inch or?
it just depends on the area. So it depends if they range from 1/2 inch to 4 inches depending on what area you're dry needling. So like these are about 2 inches, maybe 1.5 inches.
And
But
what are you feeling?
Nothing. I can feel that she's there.
You don't feel that go in?
If you're asking about pain, there's no pain. I know that she's inserting something, but I know that sounds weird.
Yeah.
But there's no pain.
and a lot of people who, it's funny, a lot of people who are more reluctant, I'll do a few before I tell, like, I'm doing it, and then I'll ask them a few later, are you doing okay? Like, have you started? So, always a good sign. But some people do feel them, like, once they go in, and then once they're in, they're good. Sometimes it's coming out, they feel them. Some people, it's hard to say because everybody's different. I tell a lot of people sometimes it's like a twinge. So if you get stung by a bee, or just if it for some reason bounces, it will bounce off a nerve because the nerves or the needles are so thin that it will just bounce off, and you might feel like a twinge, or depending on where we're doing it, might go down your leg or it might be in that area, but it will go away. It will subside after a little bit.
See bleeding?
Nope. There will be, nope. So sometimes getting them out, it'll be like if you prick your finger, but not all the time at all.
I've
So.
had my right hip done 3 times. It feels pretty good. My hip feels
So taking them out, you just put a little bit of pressure, and you can see no blood.
You just left it in like 2 minutes, 3
Mhm.
minutes?
Typically though, it's about 10 minutes.
Now, how do you feel?
I feel fine.
Did you feel an improvement?
Oh.
In that moment,
Yeah.
let's see, I don't know.
That was a short improvement. That was a short session, just so that y'all could see.
Yeah, I'm probably one of her patients that she does about 15 minutes.
Yes.
15 minutes, so my sessions are a little longer.
You get improvement right after the 15 minutes?
Yeah, by the time I'm walking out of here,
Yeah.
I'm feeling, I don't feel as, the pain itself that I usually feel from the bone on bone and trying to move around, and my range of motion. Before, and I wish that range was here, but when I came in here, previously, I couldn't do that. Because anytime you're bone on bone and things like that, your range of motion and the pain will not allow you. Since Dr. Caroline and my adjustments, I can do this, I can bend.
Skipping around.
Well, I don't know about that. But, I mean, you do have some range of motion. She actually did a shoulder, class, what week did
2
she
weeks
do?
ago.
A shoulder, and I did a hip. Because anytime your knees bother you, it affects your hip. I have not had any, I came in that day and told I said, we need to work on my hip. I have not had hip pain since that week. It's just basically my knees. we've taken some of the irritation off of the shoulder. So I'm just really working on this.
Awesome.
Yeah.
I'm too young, well, the doctors tell me I'm too young to have knee surgery because knees, artificial knees usually last about 20 years, and they would have to do them again in the next 20 to 25 years. So he just doesn't want to cut on me twice.
We don't want to do that.
So I've been suffering, and so the dry needling helps. Yes. So, and I will see my oncologist next week to tell him that I started dry needling again.
Oh, okay. Huh.
So I would say try it. You know,
I say try it too.
you have nothing to lose, but everything to gain.
Okay, so if you had like your kidney wasn't functioning full.
No, I wouldn't, no. Yeah, just different scope.
Okay.
Yeah, but more so it's more musculoskeletal. It's more working with areas that those muscles just, nothing else is really relieving it, or thank you so much. Working with more of that. Just things that, because it's going deeper that anything else can get to. So, really. Any other questions or anything?
Definitely interested in trying for my knee and my ankle.
Yeah, absolutely. Be happy to help. Or at least try to help.
Cover these treatments?
Typically not. So, but if you think of, we charge $60 if you think of how much a knee replacement would be. So, I mean, not, that it's just a drastic.
Your HSA if you have that.
Right. Yeah.
You have HSA. I use my HSA.
So, but, and typically that's a lot of what is a great thing about it is the frequency and how long it lasts. With the cost, it's so much less.
Yes, yeah.
So, like I said, some people will see, like I have my shoulder done a lot because I have tendonitis in my shoulder, and I'll actually have to do it to myself now, but not a fun thing. I don't recommend it because you have to look at it, and that will last for months at a time. So, and just after one time. And the amount of that I use my shoulder and everything. So, but sometimes it will take a couple times. So don't be discouraged if you don't see immediate results after once. It can take some. But even pregnancy, unless you're a high risk pregnancy, you can do it when you're pregnant. And then later trimester, third trimester, you want to stay away from the low back. But other than that, there's not too many contraindications to it.
Where did this treatment originate? And how long has it been around?
I'm not 100% sure about that.
Is it an Eastern modality?
China?
It's more Western. Yes.
Oh, okay.
Cupping is Eastern,
Okay.
but dry needling is more Western. So that's with acupuncture also more Chinese type. But this is just a different mentality. More working, which I like it better personally, just because it's going to where that problem is. It's going directly to it. If different muscles are going to be referred with that area of pain, we're focusing on those muscles as well. So even if you're having, say, shoulder issues, well, it could also affect muscles in your neck or upper back. So we're focusing on that as well, where we know you could have trigger points, but you don't necessarily know that. So going into those areas as well. So focusing on the bigger picture of trying to get you functioning better.
So it is good for migraines?
Yes, really good for migraines.
Where do you put the, are you talking about the needles?
Depends where, so some people have headaches that stem in the back of their head, some have more like tension headaches. So it just depends on, everybody's different, so it just depends where. But we've had Bell's palsy patients that do really well. So a lot of different things. Sinuses do very well because you can actually just hit different sinus points.
Still the needle's going.
Those are very, very tiny. Like with the TMJ, very, very tiny needles. So there's like half inch, so don't even go in half inch. So
So if
very
migraines
small.
start in the back,
You would do more in the back, in the neck.
do you have to be having a migraine for it?
Some people do more preventative, so if they typically get them, then they, like the patient that I had with the knees and having that issue, she would even just do it just every couple weeks to make sure she didn't have knee issues, because she got so into running and she continued to do horseback riding, things like that, that she just didn't want to go back to where she was. But frequency is a lot different. So it could be more preventative as well. Typically in the beginning though, I would try to do it so that way we can pinpoint exactly to where it needs to be to make sure that it's the best too for you.
How long did you go to school for that? I mean, to learn that?
It's another course that I took. So it's just like, it was a all day, 4-day course. That, and so you do it to somebody, so you have to do it to somebody's entire body and you get it done to you as well. So I know the pain when you're having it. If you do, I understand. Some areas are worse than others, but it just depends, like I said, of where your problem area is too, and how much scar tissue is there, how much muscle tension is there. So different factors. But like I said, extremities are probably, I see the most benefit, just because it's a lot of time people don't want to have surgery. They want a different route to go. And so it just adds in something else.
Can you treat myofascial pain?
So it's working with muscle pain. That's, yep.
You could do it on that.
Mm-hmm.
Oh, okay.
Yes.
Can you do it on children?
It depends. It depends. It would depend on, obviously, their parents' consent, and then all what's going on with them. So, and what age as well.
So like if they've had an injury, then that would be something.
That we could look into. But I wouldn't do.
Chiropractic where you
Right. Yes. I would.
from birth.
Right. No. Good question. Well, thank y'all so much. I hope you learned something. And if you have any questions or anything, if you're interested in anything else, but I'd be happy to answer that for you. Thank y'all so much for coming on this beautiful night.